Scoliosis is simply referring to the sideways curve in the spine when the spine should be straight up and down. Idiopathic is referring to like the type of scoliosis or what it is. And that one, it's not very easy to explain in the sense that idiopathic means we don't know what causes it. So the reality is we recognize it. It's different than, say, neuromuscular scoliosis or a type of scoliosis or curvature that's a result of having a greater neurological deficit, something like cerebral palsy or Friedreich's ataxia, where there is a major neurological injury or neurological condition that then leads to more of a secondary case of scoliosis. So idiopathic is referring to that this patient has no other major neurological changes, everything else seems to be normal, but they just have a curved spine. So idiopathic scoliosis is not just about there being a sideways curve in the spine and it should be straight up and down, but the whole condition is more three-dimensional. So whereas when a person's diagnosed with scoliosis, they're going to get an A to P x-ray, an anterior posterior x-ray, to see how much of a curve is in the spine. And yet that's just this small snapshot, kind of a two-dimensional snapshot of what that person's spine is doing. And really you could say that's the minimum amount of information we need to be able to diagnose somebody with scoliosis. The reality is, though, that size of that curve is what we call a Cobb's angle. And so that could be basically 10 degrees is where we diagnose scoliosis and up. For teenagers or young kids, the reality is you'll become a candidate for the typical or traditional hard bracing at around 20 to 25 degrees. And then when you reach around curves up about 40, 45 degrees is when you're typically a candidate for surgical fusion. So the Cobb angle numbers give us really very little information about what really is happening with each patient, but at least it's the minimum amount of information we need for diagnosing and kind of talking about their pattern.